Yet, regrettably, I believe the biggest threat to global health right now is not coming from the Chinese Communist Party. It is the reality that the United States Secretary of Health and Human Services does not believe in the germ theory of disease. He has repeatedly, over the course of his career, said that the germ theory of disease, which might be the single best supported scientific theory of biology of the last 200 years, is spurious. He favors what's called terrain theory, which is the concept that your body gets sick because of an imbalance of humors within your body, and microbes take root in your tissues to clean out the bad stuff. We are trying to prepare for a future in 2050 of pathogens, both accidental, natural.
You just watched Representative Jake Auchincloss stand before the American people and declare with unflinching moral clarity that the United States Secretary of Health and Human Services does not believe in the germ theory of disease, and if that sentence doesn't send ice water through your veins, if that doesn't make you understand exactly how precarious this moment is for the entire architecture of public health in America, then I need you to understand what we are witnessing right now is not partisan theater, not political gamesmanship, but the wholesale demolition of scientific consensus that has saved hundreds of millions of lives since Louis Pasteur and Robert Koch revolutionized our understanding of infectious disease in the 19th century. We are watching in real time as the person charged with protecting the health of 330 million Americans promotes what experts describe as terrain theory, a debunked thesis promulgated in the 19th century as an alternative to Louis Pasteur's now virtually universally accepted theory that infections are caused by germs. And you need to grasp the sheer audacity of what this represents, because this is not some minor policy disagreement about the optimal delivery system for healthcare or marginal tax rates on pharmaceutical companies. This is a cabinet secretary who quite literally rejects the foundational principle upon which modern medicine is built. And wait, because it gets so much worse than you even think it does. The implications here are genuinely staggering when you start pulling on this thread, because this year's measles outbreaks have infected more than 1,000 people in 33 states, and resulted in the first U.S. pediatric measles death in more than 20 years. Children are dying preventable deaths right now in 2025 in the wealthiest nation on earth. And what has Secretary Kennedy's response been to this unfolding catastrophe? He has downplayed the importance of measles vaccination and repeatedly promoted vitamin A supplements and vitamin A-rich cod liver oil as measures to prevent and treat measles, pushing this so aggressively that children were hospitalized with liver toxicity from overuse of vitamin A. And I want you to sit with that for just one moment, because this is the person who controls the Centers for Disease Control and Prevention, the Food and Drug Administration, the National Institutes of Health, agencies that together represent the most sophisticated public health apparatus ever constructed in human history, now being led by someone whose worldview is so fundamentally divorced from empirical reality that he is literally poisoning children with vitamins while telling their parents this will protect them from measles better than the vaccine that we know with absolute scientific certainty prevents measles. The congressman you just heard is the son of Hugh Auchincloss, who succeeded Anthony Fauci as acting director of the National Institute of Allergy and Infectious Diseases. He is quickly emerging as a key voice for Democrats on the committee in his own right, because someone has to stand up and say out loud what the entire medical establishment knows but what Republicans in Congress are too cowardly to acknowledge, that Kennedy's nomination was narrowly confirmed by the Senate with a final vote of 52 to 48, with Senator Mitch McConnell as the sole Republican to oppose Kennedy while Democrats were unanimous in their opposition. Ryan, think about what that tells us about the Republican Party in this moment, that even McConnell, who survived childhood polio and who said he will not condone the relitigation of proven cures, could not convince a single other Republican to join him in opposing a man who, wife, has said as recently as July 2023 that there's no vaccine that is safe and effective. What Kennedy promotes is not merely an alternative perspective or a legitimate scientific debate. It is based on Kennedy's own words in his 2021 book Vilifying Fauci, titled The Real Anthony Fauci, with an entire section titled Miasma versus Germ Theory in the chapter The White Man's Burden. And in that book, Kennedy quite explicitly rejects the pharmaceutical paradigm that emphasizes targeting particular germs with specific drugs rather than fortifying the immune system, creating what one vaccine expert describes as a belief system Kennedy holds like a religious conviction that there is no shaking him from, regardless of how much evidence there is to prove him wrong. And this is absolutely critical to understanding what we are dealing with here, because this is not someone who can be reasoned with through evidence or data, or the accumulated wisdom of 2 centuries of medical advancement. This is fundamentally about ideology masquerading as scientific inquiry. The hearing clips you just witnessed reveal something even more insidious about how this administration operates, because when confronted by Auchincloss about the profound corruption and conflicts of interest riddling his department, Kennedy asked if Auchincloss had accepted $400,000 from pharmaceutical companies and held up a list of lawmakers and the funds they've received from the pharmaceutical industry, with a grin, applying the classic authoritarian deflection of attacking transparency advocates for the very transparency they demand, while refusing to hold his own advisors to any standard whatsoever. Auchincloss was questioning Kennedy about Callie Means, who is a special government employee and White House advisor who introduced Kennedy to Donald Trump and is the founder and owner of TrueMed, which sells saunas and supplements to people using pre-tax dollars, describing his mission as routing federal funds away from health insurance programs towards health savings accounts, creating a direct financial pipeline from federal policy to his own company, while shaping the very policies that benefit his business. And here is where you need to understand the systematic nature of what Kennedy has done since taking office, because Kennedy disbanded an influential vaccine advisory committee that helps the government decide who should get vaccinated and when, replacing it with a much smaller number of panelists, many of whom have either been openly critical of vaccines or lack relevant expertise, literally purging the independent scientific oversight that has guided vaccine policy for generations, and replacing them with ideologues who share his terrain theory delusions. One of these appointees is Martin Kulldorff, a biostatistician and former Harvard professor fired in 2024 for refusing to take the COVID-19 vaccine, co-author of the Great Barrington Declaration, which former NIA Director Dr. Anthony Fauci called ridiculous and total nonsense. So we have gone from having the world's leading immunologists and epidemiologists advising on vaccine policy to having vaccine skeptics with financial interests in litigation against vaccine manufacturers, making these life and death decisions for American families. The scale of institutional vandalism Kennedy has perpetrated is genuinely breathtaking when you catalog it, because under Kennedy's tenure, the CDC's budget for infectious disease surveillance was reduced by 18% in fiscal year 2026. The Pandemic Response Reserve was cut by 40%. These reallocations coincide with the current measles outbreak, with over 1,200 confirmed cases as of June 2025. He is literally defunding the very infrastructure designed to track and respond to disease outbreaks during an active outbreak of a vaccine-preventable disease that is killing children. And it does not stop there, because HHS canceled a nearly $600 million contract with the drug maker Moderna to develop a vaccine against subtypes of bird flu that could trigger future pandemics after Kennedy repeatedly questioned the safety of the mRNA technology, abandoning pandemic preparedness at precisely the moment when avian influenza is showing increasing evidence of mammalian adaptation. When Trump announced during a September White House event that he suggested an overhaul to how children get vaccinated after claiming without evidence that many vaccines are unsafe as currently given, saying he has talked with Kennedy about his proposed changes, we witnessed the logical endpoint of terrain theory denialism ascending to the highest levels of executive power, and multiple doctors' organizations have now called for Kennedy's resignation because the uncontrolled measles outbreak has now resulted in 3 deaths, including 2 children, led to the exposure of newborn infants in a nursery in Texas, and continues to worsen while cancellation of CDC grants resulted in the cancellation of 50 vaccine clinics in Texas, including at schools with lower vaccination rates, while CDC cuts included staff working on the outbreak response, and simultaneously the CDC suppressed a report that emphasized the importance of vaccination. They are actively suppressing scientific information during a public health emergency, because that information contradicts their ideological commitments. The congressman in that clip was absolutely correct to frame this as a matter of national security, because Secretary Kennedy has aggressively weaponized the CDC by purging its Vaccine Advisory Committee, firing all 17 members, and replacing them with cherry-picked appointees who include vaccine skeptics, forcing out the CDC director, and triggering high-level and career staff resignations. The result is that the cuts and non-scientific directives from the Trump administration represent an unprecedented dismantling of scientific leadership and a retreat from objective, evidence-driven policy, endangering the CDC's capacity to respond credibly to health threats, according to former CDC officials themselves. These are not partisan operatives criticizing Kennedy. These are the scientists who spent their entire careers protecting Americans from infectious disease, watching in horror as their life's work is systematically demolished. What makes this particularly grotesque is the brazen hypocrisy and corruption at every level, because while Kennedy demands radical transparency and fired the 17 members of ACIP because he thinks they have conflicts of interest, his own advisors like Brad Smith served as the head of DOJ at HHS as the primary official responsible for planning and implementing the major reduction in force, while his Main Street Health's biggest investors are regulated by or transact with the Center for Medicare and Medicaid, including the largest Medicare Advantage organizations, and these MAOs benefited from the administration's reduction in oversight and increase in reimbursement. This is not draining the swamp. This is replacing public health expertise with private profit-seeking dressed up in the rhetoric of health freedom. And I want you to understand what terrain theory actually represents historically, because this is not some cutting-edge paradigm that challenges medical orthodoxy, as chemist Louis Pasteur's germ theory of disease was gaining traction in the 1800s. His rival Antoine Béchamp raised an alternative explanation that disease was caused by the state of the body, which he referred to as the terrain, arguing that a strong inner environment bolstered by nutritional food and a healthy lifestyle could fend off illness. And this theory was comprehensively debunked over a century ago through countless experiments demonstrating that specific microorganisms cause specific diseases regardless of the host's nutritional status. When we say Kennedy is a germ theory denialist, we are saying he rejects the same foundational science that gave us antibiotics, antiseptic surgery, pasteurization, water treatment, vaccines, basically every intervention that extended human lifespan from 47 years in 1900 to nearly 80 years today. The particularly cruel dimension of terrain theory is how it leads to shame and feelings of failure, because if disease is purely a function of your internal terrain rather than exposure to pathogens, then getting sick becomes a moral failing, evidence that you did not eat right, did not live virtuously, did not maintain your bodily purity, which is exactly the kind of victim-blaming pseudoscience that dominated before the germ theory revolution. Children who contract measles, pregnant women who get COVID, immunocompromised individuals who suffer breakthrough infections, all of them implicitly blamed for insufficient terrain maintenance, rather than understood as victims of infectious pathogens against which vaccines offer the only reliable protection. With this novel strain of germ theory denialism as the basic false premise of his scientific worldview, Kennedy has poisoned the well of public health discourse potentially for decades to come, according to experts, and they are absolutely right because we are already seeing the catastrophic downstream effects, as in the vacuum left by the Trump administration's chaos and politicization of science. The West Coast Health Alliance issued unified science-based vaccine recommendations ahead of the winter virus season, with Governor Newsom signing legislation authorizing California to base future immunization guidance on credible independent medical organizations rather than the CDC's increasingly politicized Advisory Committee on Immunization Practices. We are watching the fragmentation of American public health in real time as states are forced to create parallel systems because they can no longer trust federal health agencies to provide scientifically sound guidance. The Trump administration's assault on vaccines represents what scholars are now calling an undeniable pattern, an onslaught on science that follows a structured strategy from the Project 2025 playbook. And this is absolutely intentional and systematic, not random policy chaos, but the deliberate dismantling of the federal scientific enterprise in service of an ideological agenda that views expertise itself as elitist and undemocratic. When Kennedy plans to investigate a conspiracy theory that condensation trails behind aircraft release toxic chemicals and is planning to investigate climate and weather control, expected to create a task force that will recommend possible federal action, we see how thoroughly conspiratorial thinking has infected the highest levels of health policy, chemtrails investigations while children die of measles. Every single day Kennedy remains in office represents a rolling catastrophe for American public health, because it's a war on vaccines, it's war on children, and RFK Jr. is exactly what he has been for the last 20 years, which is a virulent anti-vaccine activist, science denialist and conspiracy theorist, according to Dr. Paul Offit, co-inventor of the rotavirus vaccine, and this is not hyperbole or partisan exaggeration, but the considered judgment of someone who has spent his entire career developing and studying vaccines. The medical establishment is unified in its opposition to Kennedy. More than 75 Nobel laureates urged the Senate to oppose Kennedy's nomination, saying he would put the public's health in jeopardy, and over 17,000 doctors who are members of the Committee to Protect Healthcare signed an open letter arguing that Kennedy had spent decades undermining public confidence in vaccines and spreading false claims and conspiracy theories, but Senate Republicans confirmed him anyway because loyalty to Trump supersedes the health and safety of American children. What that congressional hearing revealed is that we have Democrats like Auchincloss who are desperately trying to hold the line for science and empirical reality, while Republicans either actively embrace Kennedy's conspiratorial worldview or lack the courage to oppose it even when they know better. And with what's happening with measles in Texas and Georgia, with the first death of a child in the U.S. in 20 years, Kennedy will still not recommend the measles, mumps, and rubella vaccine to parents. According to him, chicken soup is the answer. Chicken soup for measles. In the year 2025, this would be darkly comedic if children were not actually dying. The broader implication here is about what kind of country we are becoming, because when you reject germ theory, you are not just rejecting a scientific theory, you are rejecting the entire Enlightenment project of understanding the world through empirical observation and experimental validation, rather than through tradition, superstition, or ideological commitment. Terrain theory represents a retreat into a pre-modern understanding of disease, where illness is fundamentally about moral and spiritual purity, rather than biological pathogens, and this dovetails perfectly with the broader authoritarian project of rejecting expertise, denigrating institutions, and replacing scientific consensus with strongman declarations of alternative facts. And we need to be absolutely clear about the stakes here, because the Trump administration plans to shift the federal government away from directly recommending most vaccines for children and suggest they receive fewer shots to more closely align with Denmark's immunization model, fundamentally remaking childhood vaccination in America based on cherry-picked international comparisons, while ignoring that Denmark has far higher baseline vaccination rates and different disease epidemiology. This is not evidence-based policymaking. This is using the veneer of international comparison to justify predetermined ideological commitments to reducing vaccine uptake. What you witnessed in that hearing clip was a Democrat trying to defend the basic premise that germs cause disease and that we should respond to germs with targeted antimicrobial interventions, including vaccine, and the fact that this is now a controversial partisan position rather than settled scientific fact that both parties accept tells you everything about how far we have fallen. When Senator Durbin said, "I am fearful that if we put Robert F. Kennedy Jr. in charge of our nation's health, innocent children will die," he was not engaging in partisan fearmongering, but making an entirely accurate prediction that has now come true with multiple pediatric measles deaths. The corruption angle that Auchincloss was pushing is equally crucial because Means served as a White House advisor to the HHS Secretary and publicly touted his role as a leading policymaker behind the Trump administration's Make America Healthy Again initiative, while continuing to hold financial interests in TrueMed, and Means and TrueMed appear to have profited considerably from MAHA policies, as the report encourages the expansion of tax-advantage health savings accounts and flexible savings accounts to purchase alternative health and wellness products. This is straightforward corruption. Government officials using their regulatory power to enrich their private business interests, but because it is wrapped in the rhetoric of health freedom and challenging big pharma, it gets presented as somehow virtuous. The fact that Democrats are essentially alone in opposing this madness should radicalize every single person who cares about public health, because what we are watching is one political party abandoning its commitment to science and empirical reality in favor of conspiratorial thinking and ideological purity. Any Democrat who votes to confirm RFK is betraying the Democratic Party's long-standing commitment to children's health and science. This is a man who thinks that no vaccine is safe and effective, despite the fact that vaccines have saved 146 million lives in the last 50 years. This is a man who does not think that AIDS is caused by a virus. No Democrat should be voting yes, Auchincloss said before the confirmation vote, and he was absolutely right, because this was a test of whether elected officials would prioritize science and children's lives over political expediency. Every medical professional organization in America opposes Kennedy's agenda. Every major scientific society, every public health school, and yet Republicans march in lockstep behind him because Trumpism has become a totalizing ideology that demands absolute fealty regardless of expertise or evidence. The hearing you just watched was not really about germ theory. It was about whether we will continue to live in a reality-based policy environment, or whether we will allow ideological commitments to override empirical observation. And right now the latter is winning, because Republicans control the Senate and the White House, and they have decided that loyalty to their conspiratorial base matters more than the foundational premises of modern medicine. This is why we fight. This is why we resist. This is why we cannot allow the normalization of science denial at the highest levels of government, because children are dying right now from preventable diseases, while the Secretary of Health and Human Services promotes vitamins and talks about terrain and bodily humors like we are living in medieval Europe. The arc of history bent toward justice and toward science and toward evidence-based policymaking for generations, and now we are watching in real time as that arc bends backward toward superstition and conspiracy and ideological capture, and the only thing standing between us and complete catastrophe are Democrats like Jake Auchincloss, who are willing to stand up in congressional hearings and state plainly and clearly that the emperor has no clothes, that germ theory is real, that vaccines work, that children are dying, and that this is a moral emergency that demands our immediate and sustained resistance.